Question 1. In light of recent developments, is Taylor, a registered radiologic technologist, is approached by a pharmaceutical company offering financial compensation in exchange for her sharing anonymized imaging data collected at her hospital. While the company assures her that patient identifiers will be removed, the request is informal and no institutional review board approval has been sought. Taylor is enthusiastic about contributing to research but is unsure how to proceed ethically. What should Taylor do in this situation? A. Agree to share the data as long as no identifiers are included. B. Decline the request and report the company to the ARRT. C. Inform her department head and ensure ARRT approval before participating. D. Anonymize the data herself and then share it for research purposes. Answer. Correct answer. C. Inform her department head and ensure ARRT approval before participating. Explanation. Sharing patient data, even when anonymized, requires ethical oversight through proper research protocols, including ARRT approval. According to the ARRT Code of Ethics, Principle 10, a technologist must support the ethical conduct of research involving human participants. Informal or unauthorized data sharing can still violate confidentiality and institutional policy. Furthermore, under the ARRT Rules of Ethics, Rule 22, any misuse or unauthorized release of medical records is considered a serious breach. MS. Taylor's best course of action is to elevate the matter to her department and obtain ARRT approval to ensure full ethical compliance. Option A and D neglect institutional authority and legal protocol. Option B is excessive without first verifying intent or protocol breach. Question 2. From the perspective of maintaining competence, which of the following best illustrates a radiologic technologist's responsibility as outlined in the ARRT Standards of Ethics? A. Attending mandatory annual training on fire safety. B. Pursuing continuing education. C. Specific to emerging imaging techniques. C. Reporting colleagues' lateness to the supervisor. D. Avoiding conflicts with hospital administrators. Answer. Correct answer. B. Pursuing continuing education. C. Specific to emerging imaging techniques. Explanation. The ARRT Code of Ethics Principle 9 emphasizes that a technologist must continuously strive to improve knowledge and skills. Participating in relevancy helps maintain clinical competency, which is critical to safe and ethical patient care. While fire safety training is required, it does not reflect the technical and ethical obligation. Radiologic practice, reporting tardiness, or avoiding conflict may be workplace etiquette but are not directly linked to ethical professional development. Thus, option B directly fulfills the requirement of lifelong learning as stipulated by ARRT's professional standards. Question 3. Based on the information, Mr. Hassan, a radiologic technologist, was notified that his license is under investigation due to allegations of substance abuse. While the investigation is ongoing, he continues to work with patients but does not disclose the issue to his employer or the ARRT. Eventually, the state board suspends his license. However, he applies for a technologist position in another state, omitting any mention of the suspension. What violations has Mr. Hassan committed? A. Subversion of ARRT certification and employment fraud. B. Lack of continued education and patient abuse. C. Improper equipment use and breach of safety protocols. D. HIPAA violations and negligence in reporting. Answer. Correct answer A. Subversion of ARRT certification and employment fraud. Explanation. According to ARRT Rules of Ethics, Mr. Hassan's actions represent subversion, Rule 5, by intentionally withholding material facts during application, and fraudulent representation, Rule 18, in seeking employment while knowingly under suspension. Continuing to practice while impaired or under investigation violates Rule 7, which pertains to unfitness to practice. Violations compromise public safety and breach the ARRT's commitment to integrity and transparency. Option B, C, and D miscategorize the primary ethical violations in this scenario. Question 4. While examining the responsibilities of healthcare professionals, which of the following actions most directly supports a technologist's duty to respect patient autonomy? A. Choosing the best imaging technique without informing the patient. B. Proceeding with scan despite the patient's refusal to consent. C. Fully explaining the procedure and obtaining informed consent. D. Allowing family member to make decisions without confirming legal authority. Answer. Correct answer. C. Fully explaining the procedure and obtaining informed consent. Explanation. Respecting patient autonomy means acknowledging the patient's right to make informed decisions. The Code of Ethics Principle 1 requires the technologist to act in the best interest of the patient, and Principle 2 emphasizes respect and dignity. Informed consent is a cornerstone of ethical medical practice, and failure to obtain it can lead to legal consequences and ethical sanctions. Options A, B, and D undermine patient rights and fail to meet the requirements for consent and communication. Question 5. Under the assumption that a radiologic technologist becomes aware that a colleague frequently modifies digital images to enhance diagnostic clarity without documentation or physician request, what is the most ethical course of action? A. Ignore it, since the outcome is better for patient care. B. Confront the colleague and demand they stop immediately. C. Report the behavior to the supervisor or ethics committee. D. Attempt to replicate the technique to learn how it works. Answer. Correct answer. C. Report the behavior to the supervisor or ethics committee. Explanation. Image manipulation without proper documentation is a serious ethical concern. The Rules of Ethics Rule 17 explicitly prohibits the falsification of images or documentation. Even if well-intentioned, altering diagnostic images without proper oversight can lead to misdiagnosis and legal liability. Ethical practice demands accountability, transparency, and reporting unethical behavior. Per Rule 23, duty to report. Confronting the colleague informally, B, may not result in systemic correction, and ignoring the issue, D, contributes to unethical culture. Question 6. The growing trend in digital communication raises ethical concerns about protecting patient privacy. The technologist MS Ramirez takes a photograph of a rare pathology scene during a scan and shares it with her study group in a private messaging app, ensuring no patient identifiers are visible. She justifies it as a learning tool. Which ethical principle has she potentially violated? A. None, since no identifiers were shared. B. Rule of ethics concerning patient confidentiality. C. Code of ethics principle regarding continuing education. D. Rules regarding patient consent to procedures. Answer. Correct answer. B. Rule of ethics concerning patient confidentiality. Explanation. Even when patient identifiers are removed, unauthorized sharing of medical images, even for education, can still breach out Rule of Ethics Rule 22, which mandates strict confidentiality of all patient-related materials. The intent does not override the requirement for institutional approval and patient consent, especially in digital contexts. Option A wrongly assumes visual identification is sufficient. Option C is unrelated, and D pertains to consent for procedures, not for image distribution. Question 7. Throughout the course of her career, MS Lang has diligently followed all ethical requirements. However, she notices that her imaging department often asks unqualified trainees to operate machines under minimal supervision due to staffing shortages. She's concerned that this may breach professional and legal boundaries. What is MS Lang ethically obligated to do? A. Mentor the trainees herself and ensure they perform correctly. B. Discuss her concerns with hospital administrator or ethics board. C. Stay silent to avoid workplace conflict during staffing crisis. D. Report the department to news agency anonymously. Answer. Correct answer. B. Discuss her concerns with a hospital administrator or ethics board. Explanation. The Code of Ethics Principle 11 obliges technologists to act responsibly and report unethical practices. Allowing unqualified individuals to perform procedures can lead to patient harm and violates Rules of Ethics 1 and 7 regarding safe, competent, and authorized practice. MS Lang's best approach is to follow institutional channels to address the issue professionally and ethically. Option A does not resolve the systemic issue. Option C and D are ethically unsound and potentially damaging. Question 8. Contrary to popular belief, which of the following actions is not a violation under the Rules of Ethics? A. Using a personal login to access patient records for a case not assigned to them. B. Failing to report a due conviction that occurred outside of work. C. Participating in a C course that is not approved. D. Filing a complaint about unprofessional conduct witnessed in the workplace. Answer. Correct answer. D. D. Filing a complaint about unprofessional conduct witnessed in the workplace. Explanation. Filing a complaint when witnessing unethical behavior is not a violation, it is an ethical obligation. The ARRT encourages reporting of misconduct, Rule 23. The other options each reflect violations. A. Breaches HIPAA and rules. B. Involves failure to self-report criminal activity, Rule 15. C. Relates to failings, requirements which must meet ARRT standards. Therefore, D is the correct ethical action. Question 9. When considering ethical boundaries in radiologic practice, which of the following most clearly demonstrates unprofessional conduct? A. Administering contrast under physician direction. B. Giving detailed scan results to a patient. C. Explaining the scan process in layman's terms. D. Reporting imaging abnormalities to a supervising radiologist. Answer. Correct answer. B. Giving detailed scan results to a patient. Explanation. Interpreting or communicating diagnostic results is beyond the scope of practice for radiologic technologists unless specially credentialed or authorized. This falls under a rule of ethics 2, which emphasizes practicing within one's scope and competence. It is also a violation of professional boundaries, potentially leading to miscommunication and patient distress. Options A, C, and D are appropriate when done under supervision or in line with role responsibilities. Question 10. As a result of a mistake during an AP procedure, Mr. Blake realizes he used a higher dose of radiation than necessary. The patient is asymptomatic and the physician is unaware. Mr. Blake considers not reporting the error, fearing repercussions. What is the most ethical response? A. Say nothing since the patient is not harmed. B. Report the incident to the proper internal authority immediately. C. Apologize to the patient and advise them to speak to a lawyer. D. Adjust the dose in the record to match protocol and avoid attention. Answer. Correct answer. B. Report the incident to the proper internal authority immediately. Explanation. According to our Code of Ethics Principle 5, technologists must exercise professional judgment and integrity. Errors that may affect patient safety, regardless of immediate harm, must be reported. Failing to report is also a violation of our Rule of Ethics 23 concerning ethical obligation and transparency. Adjusting records, option D, constitutes falsification, serious ethical breach. Silence, option A, and legal suggestions, option C, deviate from professional protocol and escalate risk. Question 11. In light of recent developments in the healthcare sector, the use of artificial intelligence (AI) in radiology has raised ethical concerns. A radiologic technologist, Jane, is asked to use an AI-based tool for detecting anomalies in radiographs, but she notices that the system occasionally misidentifies certain abnormalities, potentially putting patients at risk. What should Jane do in this situation? A. Use the AI tool without hesitation as it is the latest technology available. B. Document the issue and proceed, but inform her supervisor later. C. Refuse to use the AI tool until its reliability has been thoroughly assessed and ensure patient safety. D. Continue using the AI tool but disregard minor errors as they do not significantly affect patient outcomes. Answer. Correct answer. C. Refuse to use the AI tool until its reliability has been thoroughly assessed and ensure patient safety. Explanation. According to the standards of ethics, radiologic technologists have a responsibility to act in the best interests of the patient and prioritize patient safety. Principle 1. This includes using equipment and technology that is fully assessed for accuracy and reliability. Using AI tools without it. Potential errors could compromise patient care, violating the ethical obligation to prevent harm, non-maleficence. Question 12. In a context of maintaining professional integrity, a radiologic technologist named Mark is aware that a fellow colleague, Alice, is regularly arriving late for shifts and not properly documenting patient interactions. Mark is unsure if he should report Alice's behavior. What should Mark do according to the Code of Ethics? A. Ignore the situation since Alice is a colleague and it is not his responsibility. B. Discuss the matter with Alice privately and encourage her to improve her professional behavior. C. Report Alice's behavior to the appropriate authority to ensure patient care standards are not compromised. D. Confront Alice in front of other staff members to ensure accountability. Answer. Correct answer. C. Report Alice's behavior to the appropriate authority to ensure patient care standards are not compromised. Explanation. According to the rules of ethics. Rule 2. Radiologic technologists must report unethical conduct that may harm patients or the profession. It is Mark's duty to address issues that could compromise the safety, well-being, or dignity of patients. Reporting ensures the continuation of high professional standards, protects patient care. Question 13. During a routine exam, Dr. Smith notices that the radiologic technologist, Tom, has forgotten to ask for patient consent before performing a procedure that involves a significant amount of radiation exposure. How should Tom handle this ethical lapse? A. Proceed with the exam and ask for consent after the procedure. B. Immediately stop the procedure and explain the mistake to the patient, seeking consent before resuming. C. Apologize for the oversight but continue the exam as the procedure is non-invasive. D. Ignore the situation as consent is only necessary for more invasive procedures. Answer. Correct answer. B. Immediately stop the procedure and explain the mistake to the patient, seeking consent before resuming. Explanation. Informed consent is a fundamental ethical requirement in healthcare as outlined in the Standards of Ethics, Principle 5. The patient has the right to understand the procedure and the associated risks before consenting. It is the radiologic technologist's responsibility to ensure that informed consent is obtained. Patient is fully aware of what the procedure entails. Question 14. Given the circumstances, a radiologic technologist, Sarah, is assigned to take imaging for a patient who speaks a different language. The hospital has provided her with a translator service, but she notices that the translator may not fully understand the medical terminology involved in the procedure. What should Sarah do? A. Proceed with the exam and trust that the patient will understand the basic procedure. B. Use the translator service but proceed without worrying about medical accuracy, assuming it will be understood. C. Ensure the translation service is accurate and that the patient fully understands the procedure before proceeding. D. Skip the translation process and attempt to explain the procedure herself using simple language. Answer. Correct answer. C. Ensure the translation service is accurate and that the patient fully understands the procedure before proceeding. Explanation. The Code of Ethics stresses the importance of clear communication and patient understanding. Principle 6. When language barriers exist, it is essential to use accurate translation services to ensure informed consent and that the patient is fully aware of the procedure. Miscommunication can lead to ethical violations. Lack of informed consent. Question 15. To better understand the ethics surrounding confidentiality, consider the following scenario. During a routine checkup, a radiologic technologist, Anna, notices that a patient's imaging results are mistakenly placed in public area of the hospital. What should Anna do to maintain patient confidentiality? A. Leave the images in the public area as they are not personally identifiable. B. Immediately secure the images and report the breach of confidentiality to her supervisor. C. Inform the patient about the mistake and let them handle it. D. Ignore the situation as no harm has been done. Answer. Correct answer. B. Immediately secure the images and report the breach of confidentiality to her supervisor. Explanation. According to the rules of ethics, Rule 3, safeguarding patient confidentiality is a primary responsibility of radiologic technologists. Any breach of confidentiality, including improper handling of patient images, must be immediately addressed. Reporting the issue ensures that it is corrected and that patient trust is maintained. Question 16. In the context of patient care, a patient named Mrs. Harrison is requesting to view her radiographic images before the procedure is performed. The radiologic technologist, Joe, is unsure whether to allow this. What should Joe do? A. Allow Mrs. Harrison to view the images but explain that they are not final. B. Deny the request because the images are not finalized and could be misinterpreted. C. Allow the patient to see the images without any explanation. D. Explain the process to Mrs. Harrison and, if needed, arrange for a discussion with the physician afterward. Answer. Correct answer. D. Explain the process to Mrs. Harrison and, if needed, arrange for a discussion with the physician afterward. Explanation. The ARRT standards of ethics emphasize the importance of clear communication and informed patient engagement. Principle 6. Although patients do not have the right to interpret medical images themselves, they should be allowed to understand the process and concerns should be addressed. In cases of confusion, it is appropriate to arrange for further discussion with the physician. Question 17. The ethical principle of non-maleficence is crucial in radiology. Tim, a radiologic technologist, notices a colleague, Paul, using outdated equipment that could potentially result in higher radiation exposure to patients. What should Tim do in this situation? A. Ignore the issue as the equipment is still functioning. B. Inform Paul about the risks but continue using the equipment to avoid delays. C. Report the outdated equipment to the relevant authorities and ensure the equipment is replaced or repaired. D. Use the equipment only for non-critical procedures to minimize patient risk. Answer. Correct answer. C. Report the outdated equipment to the relevant authorities and ensure the equipment is replaced or repaired. Explanation. The principle of non-maleficence mandates that healthcare professionals must avoid causing harm. Principle 2 of the standards of ethics. Using outdated equipment that may increase radiation exposure is unethical and could compromise patient safety. It is Tim's responsibility to report the situation to ensure safety is not compromised. Question 18. Considering the evolution of professional ethics, John, a radiologic technologist, is concerned that a new policy from his hospital could lead to a conflict of interest. The policy encourages staff to refer patients to a particular medical equipment supplier, which benefits the hospital financially. What should John do? A. Follow the policy as it supports the hospital's financial interests. B. Report the potential conflict of interest to his supervisor or an ethics committee. C. Encourage patients to use the referred supplier as it might help the hospital. D. Ignore the conflict of interest and focus solely on patient care. Answer. Correct answer. B. Report the potential conflict of interest to his supervisor or an ethics committee. Explanation. According to the Code of Ethics, Principle 8, radiologic technologists must avoid conflicts of interest that could compromise patient care. The hospital's policy may place John in a position where financial interests interfere with his professional duty to act in the patient's best interest. Reporting this to the appropriate authority, transparency, and protects patient care. Question 19. Given the circumstances, a radiologic technologist, Lisa, is required to operate a new imaging system that she has not been fully trained on yet. The system is critical to the patient's care and the patient is waiting. What should Lisa do? A. Proceed with the exam, relying on her general knowledge of imaging systems. B. Ask more experienced colleague to operate the system while she assists. C. Refuse to use the system and delay the exam until she receives adequate training. D. Attempt to learn how to use the system while performing the exam to save time. Answer. Correct answer. B. Ask a more experienced colleague to operate the system while she assists. Explanation. According to the standards of ethics, Principle 7, radiologic technologists must maintain competence and ensure that they only perform tasks within their skill set. If Lisa is not trained on the new system, asking for help from a more experienced colleague is the most ethical choice. This ensures patient care is not compromised while to professional competence standards. Question 20. A radiologic technologist, Steve, receives a gift from a pharmaceutical representative who frequently visits the hospital. The gift is valued at a substantial amount. What should Steve do to maintain ethical integrity? A. Accept the gift as it is, a gesture of appreciation. B. Refuse the gift to avoid any potential appearance of favoritism. C. Accept the gift but disclose it to his supervisor to maintain transparency. D. Keep the gift but make no disclosure to anyone. Answer. Correct answer. B. Refuse the gift to avoid any potential appearance of favoritism. Explanation. Accepting gifts from vendors or suppliers can lead to conflicts of interest or the appearance of undue influence as stated in the rules of ethics. Rule 5. Steve should refuse the gift to maintain the trust and integrity of his professional relationships and avoid any situation that could undermine patient care. Question 21. Emily, a radiologic technologist, is performing a procedure on a pediatric patient. The child's parent insists on remaining in the room without protective lead shielding despite being informed of the radiation risks. What is the most ethically appropriate action for Emily to take? A. Allow the parent to remain in the room without protection as long as they accept the risks. B. Proceed with the exam while placing the parent behind leaded glass window. C. Insist that the parent wears appropriate shielding or leaves the room before proceeding. D. Cancel the exam due to non-compliance from the parent. Answer. Correct answer. C. Insist that the parent wears appropriate shielding or leaves the room before proceeding. Explanation. According to ARRT Standards of Ethics, Principle 7, technologists must minimize radiation exposure to patients and others. Emily must enforce safety protocols to protect the parent, even if they insist otherwise. Question 22. A patient undergoing a sensitive imaging procedure confides in the radiologic technologist Derek about a past traumatic experience and asks that only same-gender staff be present. However, the current shift only has male technologists. What should Derek do? A. Respect the patient's wishes and delay the procedure until female staff member is available. B. Reassure the patient and proceed with the available team to avoid scheduling issues. C. Assign male assistant to stand by while Derek performs the procedure alone. D. Proceed as planned while avoiding conversation with the patient to limit discomfort. Answer. Correct answer A. Respect the patient's wishes and delay the procedure until female staff member is available. Explanation. ARRT's Code of Ethics, Principle 1 and Principle 6 emphasizes patient dignity, autonomy, and respect. Patient-centered care means accommodating reasonable requests when possible, especially when related to trauma. Question 23. During a department audit, a supervisor finds that Mia, a radiologic technologist, has used her personal cell phone to take pictures of a rare skeletal anomaly for educational purposes. The images did not include identifiable patient information. What is the most ethical assessment? A. Mia acted unethically by violating confidentiality regardless of anonymity. B. Mia acted ethically since the patient was not identifiable. C. Mia should have asked the patient's permission and documented it. D. Mia acted within professional boundaries if she used it solely for education. Answer. Correct answer A. Mia acted unethically by violating confidentiality regardless of anonymity. Explanation. Per a rule of ethics number 22, taking images without authorization breaches confidentiality. Even if identifiers are absent, permission must be documented for educational use. Question 24. A technologist is being pressured by her supervisor to speed up imaging exams to accommodate more patients per hour. This pressure results in rushed positioning and occasional repeat exposures. What should the technologist do? A. Comply with the supervisor's request to avoid conflict. B. Document the supervisor's request and report it to the ethics or compliance officer. C. Speak privately with the patients to explain the situation. D. Prioritize quantity over quality as long as critical images are obtained. Answer. Correct answer. B. Document the supervisor's request and report it to the ethics or compliance officer. Explanation. Our rules of ethics require technologists to protect patient safety and avoid repeat exposures. Reporting coercion that leads to compromised imaging quality or patient harm is the ethical path. Question 25. Carlos, a radiologic technologist, overhears a conversation between nurses discussing a celebrity patient's diagnosis. Later, he shares what he heard with friends outside of work. What ethical principle did Carlos most clearly violate? A. The principle of technical competence. B. The principle of professional accountability. C. The obligation to maintain patient confidentiality. D. The need to comply with state laws. Answer. Correct answer. C. The obligation to maintain patient confidentiality. Explanation. Rule 3 specifically mandates confidentiality. Discussing patient information, especially sensitive or high-profile cases outside of clinical need, is a direct violation. Question 26. A radiologic technologist, Natalie, posts on her personal social media about a weird case she had today, describing the unusual findings without naming the patient. Her post includes the exam type, time, and hospital department. What ethical breach, if any, has occurred? A. No breach, because no names were used. B. Ethical breach for failing to anonymize all patient data. C. No breach if her account is private. D. Ethical breach only if the patient complains. Answer. Correct answer. B. Ethical breach for failing to anonymize all patient data. Explanation. Rule 3 stresses that even indirectly identifiable data, exam time, location, context, can breach confidentiality. Healthcare professionals must avoid posting about patients in public forums. Question 27. During a training session, the student radiographer asks their supervisor if it's acceptable to perform an exam they've observed but not yet practiced. The supervisor says yes to save time. What is the most appropriate response from the student? A. Refuse and ask to first complete hands-on training with supervision. B. Proceed to demonstrate confidence. C. Perform the exam and seek feedback afterward. D. Ask fellow student to guide them during the exam. Answer. Correct answer A. Refuse and ask to first complete hands-on training with supervision. Explanation. Our Code of Ethics, Principle 9, and Student Safety Guidelines emphasize competence before practice. Performing unsupervised procedures without adequate training is both unethical and unsafe. Question 20. A technologist working in a multicultural setting notices that a patient's religious beliefs restrict certain imaging procedures unless performed by someone of the same gender. No same-gender technologist is on shift. What should be done? A. Proceed with the exam while apologizing for the inconvenience. B. Defer the procedure and notify scheduling to accommodate cultural needs. C. Have a same-gender nurse stand in for appearance. D. Inform the patient that preferences cannot be guaranteed in a clinical setting. Answer. Correct answer. B. Defer the procedure and notify scheduling to accommodate cultural needs. Explanation. Our Code of Ethics, Principle 1 and 6, support culturally sensitive and respectful care. Accommodating such requests maintains patient dignity and ethical integrity. Question 29. Liam is shadowing a senior technologist who often jokes with patients in a sarcastic manner. One patient appears uncomfortable, but the technologist continues. What is the most ethical action for Liam to take? A. Say nothing, as the patient didn't complain. B. Emulate the senior technologist to learn acceptable behavior. C. Report the behavior to supervisor or preceptor after the session. D. Join in to make the patient feel more comfortable. Answer. Correct answer. C. Report the behavior to a supervisor or preceptor after the session. Explanation. Even subtle behaviors that disrespect patient dignity violate our Code of Ethics, Principle 1. Students and professionals alike must report observed conduct that compromises care or professionalism. Question 30. Why a registered radiologic technologist is offered a high-paying job in another state where licensure is not mandatory. However, she knows her credentials have lapsed and the employer is unaware. What should she ethically do? A. Accept the job and plan to renew her credentials later. B. Notify the employer and begin the renewal process before accepting. C. Begin work while submitting renewal paperwork. D. Accept the role under a different job title to avoid scrutiny. Answer. Correct answer. B. Notify the employer and begin the renewal process before accepting. Explanation. Practicing without current credentials violates our Rule of Ethics number 1 and number 10. Full transparency and valid credentials are mandatory before beginning work, even in states with relaxed laws.